We know that 70% of Canadians think too much unhealthy food is marketed to children. We know that kids' TV shows on average show 4 to 5 junk food ads per hour. These, of course, are visible sources of marketing. There's also a concept called astroturfing, where firms fund bloggers or grassroots organizations to promote their product, concealing by wrapping their products in seemingly benign or unassuming personal stories. New ephemeral social media marketing makes it increasingly difficult to track and target new media influence as well. Cambridge Analytica-style data mining and algorithms are not just for political influence, but also for marketing influence, which influences and includes unhealthy food marketing to children. And of course, marketing isn't just advertising, but overt and subtle brand or product presence at our arenas, gyms, schools, universities, hospitals, churches, temples, mosques, and so on. Meanwhile, globalization means that even limiting Canadian marketing on our soil doesn't limit online marketing from elsewhere, because our fates as global citizens, of course, are intertwined. I'd like to introduce to you the first of our speakers to explore the topic of food marketing to children, problems, policies, and possibilities. They will each speak for 12 minutes, and if they go over, Pablo will pull the fire alarm. After the final speaker, we will move to a panel and Q&A. First up is Hasan Hutchinson, who is the Director General of the Office of Nutrition Policy and Promotion at Health Canada and co-chair of Canada's Dietary Reference Intake Steering Committee and of the Federal Provincial Territorial Group on Nutrition. He serves on a number of nutrition-related committees at the World Health Organization and the World Cancer Research Fund International. I was telling my nephew about the Canada Food Guide, and we were at Co-op recently. He pointed to a uniformed staff restocking vegetables, and he asked, "Is that the Canada Food Guy you were talking about?" To which I said, "No, the Canada Food Guy is Hasan Hutchinson."
I don't know, I sort of like the idea of a big stack of vegetables. I think that's perfect. So often when we're working on dietary guidance, I think if we could just get that across to kids all the way up, that really all you really have to do is make sure you're getting half your plate full of fruits and vegetables, and we're pretty much most of the way there. You know, it's the simplicity of it all. And that's part of, I guess, where we're trying. Here, I'm losing my 12 minutes. I ran overtime last night, so I'm going to try and stay on track. I'm not going to go on to another story. Okay, so somewhere here, we do have a short presentation about where we're going. Now, marketing to kids, you gave a nice introduction to that, and I think we're all aware just what sort of an impact marketing to kids has, or what is marketed to kids. I think the estimates are that over 90% of the foods that are marketed to kids through all these different means, these different media types, are high in fats, high in sugars, high in sodium as well. So these are not really promoting healthy eating, what's getting to our kids here. And we know as well that the kids are affected by what they're seeing. This advertising changes what they're demanding of their parents to bring into the house. And we know that parents are bringing things into the house. And we know that then you're changing the consumption patterns of kids as well. So we have to do something about that. So what we've been doing, of course, we would get back again to our mandate commitment that's been made by, again, the Prime Minister asking my minister to really do something about this. We've heard already last night a little bit at least about the Bill S-228 introduced by Senator Nancy Greene-Raine. Do I have to say former Senator Nancy Greene-Raine? Or whatever. As of Friday was your last day of your wonderful career. And so there's an act in Parliament which hopefully will go through third reading fairly soon. And as well as that, of course, we're working on developing the policy, developing the regulations that go along with that particular act. Where are we here? So last summer, at this time, we were actually out in the field doing consultations on what could be proposals for our policy going forward. We had well over 1,140, well, we had exactly 1,146 submissions. And I think it was Mary Labbe was talking about, we read through every damn one of those submissions really too. So we do read your cards and letters as they do come in. And we have as well, from an openness and transparency perspective, we have published all of that as well, and that was published back in December, available online. And then we've used all of that reflection now to sort of determine what is our policy way forward. We published that about a month ago, I think it was. There's like a 4-page update that sort of sets out the areas that we're moving forward with on the policy and what we're developing into regulations. And I'll do a very fast walk through on this. So there are basically three main components with respect to the development of our policy. The first is to define, what are unhealthy foods? What are the parameters you're going to use to say, well, this is a food that you can or can't market to kids. And then it's about how is advertising being directed? How's marketing being directed? Is this child-directed or is it not child-directed? And then are there particular exemptions that we want to do? And we did a lot of that consultation last year, as I said. And so we do have an exemption, which I'll talk about a little bit further. Informed, as I said, by consultation, expert advice, and as always is necessary to really look at what we know about the science behind that. Defining unhealthy food, what we've moved into is a model that's actually quite simple. We did, again, do consultation on different sorts of thresholds that we might set to define this. So, the bottom line is that we're using what we call from nutrient content claims the low-in sodium threshold, low-in saturated fats, low-in sugars as well. And that really comes out roughly for the sats and sodium. It's around a 5-6% of the daily value, the percent DV that you see on your package. So it's really quite low. And then with saturated fats, it's more around sort of 8 to 10% is what we're using as that particular threshold. So basically, if it doesn't have any of those things added to it, or if it is up to those low-in claims, then you can go forward and you can advertise on it. But once it hits those claims, then you will not be able to market it. So, and the other thing, of course, if it has a front-of-pack symbol, then it gets out as well. But that's based on higher than 15% on all of those. And so the bottom line is that we really do want to cut out the marketing of unhealthy foods, what we're defining as unhealthy foods, for the purpose of marketing to kids, as I said, these low-in levels. But we do want to see perhaps that people could still be promoting openly the healthy foods, the basic fruits and the vegetables and the things that don't have all of these nutrients of public health concern added to it. So that's our basic model that we're using for that. And then if you're trying to determine whether it is child-directed, this gets a bit more complex here because we're talking about, sort of, as we say, exposure and the power of the technique. So what we're proposing here on our way forward is to have three primary factors. First of all, it's the setting. So if it's a school, if it's a children's festival, obviously that is a child setting, and that would definitely be, you cannot advertise in that particular type of a setting. But there are still, of course, some settings that would have lots of, like a basic amusement park, because it's a mixture of different ages, and you don't necessarily have a whole whack of kids at an amusement park at any one time. That wouldn't necessarily get out as a setting, but we'll come back and talk about how we deal with those sorts of situations under advertising techniques. Media channels, a similar way, and we're being comprehensive with respect to the media channels. You can't just concentrate on TV. As was mentioned again in the introduction, there are so many different ways that advertising and marketing can be targeted at children. So here, it's inclusive. What we are proposing going forward is that we have an audience threshold. Well, first of all, if it's a TV station or a game or a website that is, has like a children's rating on it, well, then it's obviously directed at children. So those things are automatically out as well. And children's TV stations are automatically out because that is the purpose of them, to go to children. But if there's still up to over 15% of an audience threshold in any sort of TV station or print or whatever, then you can't advertise there either. Okay, so that's with respect to settings and media. 5 minutes remaining, not too bad. Then we get into the advertising techniques. So even if you're not in a child setting, even if you're not in a media that it's directed at children, what we want to do is control for the advertising techniques. So if you're watching one of these America's Got Talent, well, it wouldn't be America's or Canada, I don't even know what these things are called, Canada's Got Talent thing, if they are doing commercials that are obviously directed at children by the color or the characters that they're using or the spokespeople that you're using, well, then you wouldn't be able to do that either. So it's a little bit of a complex thing. You have three different types of factors that you sort of go through, and hopefully what that does is control for most of the exposure that kids are getting. Sponsorship, I did mention that we did, in our consultation, got a lot of feedback about this, and what became clear is that, we are not wanting to inadvertently stop the support of or the opportunity for children to take place in physical activities. So we are saying we're exempting sports sponsorship, but at the same time, we do want to make sure we're considering here, do you have conditions on that so that for children under 13, you don't want to have product giveaways, you don't want to have prizes, you don't want to have mascots involved in that as well. So even though we are suggesting, well, we are having an exemption, there should be conditions around that as well. An important part of this going forward is the monitoring. And again, that was something that Mary Libin brought up as just part of your routine. So what has been introduced into the legislation, which hopefully will go through soon, was that there would be a 5-year parliamentary review. And as part of that parliamentary review, as well as looking at what's happening with respect to exposure and power to kids under 13, we would also be focusing on that group that's just outside of it, and the teenagers, and really following what's happening there. Because we don't want companies just to shift from their advertising dollars to under 13 to all of a sudden bombard this age group that's just a little bit higher, because there's a lot of back and forth, and we know that teenagers are very susceptible to this sort of work as well. So we are really committed to a very extensive monitoring program, and not just waiting for 5 years to report, but we envision that we would be reporting on a yearly basis with respect to what's happening with advertising to kids. So this is where I guess I'm probably down to about 2 minutes. I'm not going to go through, this would take me 12 minutes alone going through our early thinking about how to doing the monitoring here. We have met with a whole group of national, international experts to sort of inform our approach going forward. We've contracted with a prof at University of Alberta, Monique Potvin-Kent, who has published a lot of the work that's happened in Canada with respect to monitoring and evaluation. Several people who are in this room have been part of our group of experts as well on this. There are lots of challenges, of course, when you're talking about monitoring, where your data and methods coming from. The marketing landscape is absolutely mixed. Again, in the introduction, this is very subtle. And so how do we actually make sure that we're monitoring all the different aspects of marketing? And how do we actually involve Canadians in the sense of getting understanding and support that we have to put in place to protect our kids, and really to help families as well to really put healthier meals on their dining room tables as well. So there are research gaps as well, and we'll be addressing those in a sort of a separate mechanism. I've got commitments from my minister in terms of really making sure that the resources are available to do both the monitoring and to establish where research gaps are so that we're prepared into the future on this. And basically the next steps here with monitoring, we are, as I said, just putting together our whole marketing framework. We'll be starting to gather the information that we need as a baseline before all of this goes live. So from monitoring, we are really working on that. We'll have things into place over the next 6 months or so. And then from regulations, we hope that we will be going out, 1 minute remaining, perfect. Consultation would be in the fall sometime of 2018, following up from the bill going through and getting royal assent. So I think that's where we are. Thank you.
In this presentation, I want to give credit to a PhD candidate who's working with me, Rachel Prowse, who did a lot of the background work in looking at the literature in this area, and and then published a paper in Health Promotion and Chronic Disease in Canada about 6 months ago. So all of this is documented in that paper. So I'm going to talk about food marketing and food environments. I'm going to talk more about the problems and less about the possibilities, because we've just heard some of the possibilities from Hasan, and then I also want to leave some of the possibilities to the person who's going to be speaking on advocacy, and that is Ashley. So why should we care about food and beverage marketing to children? I think we're in a room where we're preaching to the converted here, so I won't go into this in great detail, but we do know from the evidence that exposure to food marketing changes kids' attitudes towards nutrition, it changes their food preferences, and it changes their eating behavior. And we've known this for well over a decade now. So it's important for us to look at food marketing. When we think about where our messages come from too, this is American data, but I don't think it would be too different in Canada. When we look at the yearly expenditures of industry food marketing to children, it's about 1.8 billion a year. And for one of the largest funded public health nutrition campaigns in the US, the NCI's 5 a Day campaign was $2 million a year. So it's almost 100 times as much is spent by industry as public health in promoting food. And so that means that every 3 days, and the industry spends what public health spends in a year. So when you hear the critique that we just need to educate people, that's, unless we have a lot more money to do that education, that's not going to really address it. So one of the ways in which we can address it is by controlling how much of that industry money gets to our children. So the food marketing landscape is very vast and complicated. Probably the only time during a kid's day that they're not exposed to marketing is while they're asleep, unless they're dreaming of the latest commercial that they watch just before bedtime. But so when you think about from the time that they wake up, perhaps while their moms and dads are getting ready for work, they might be spending a half an hour in front of the television. Then perhaps they even have their breakfast at a drive-through restaurant. Then they go to school. There's marketing there too. I'm going to explain some of these things. Then they might stop in the grocery store on the way home. They might watch a TV show at home, and then they might play on the internet. They might go to a sports facility. So there's lots and lots of potential exposure to food marketing. And what determines the impact of that food marketing on children? Well, we heard this from Hasan. First of all, it's the exposure, which is the reach and the frequency of an ad. So how many children see it? And how often do they see it? And then there's the power, and that's the features that make the ad persuasive. So it can include things like creative content, design, and execution. So even looking at this bank of sweetened beverage machines, if you look at the Powerade machine, it's got sports figures on it. So that's appealing to children, and it would suggest that if you're playing sports, that perhaps you should consume this sugary drink. So all of these types of things are impacting food marketing on kids. So we often think just about television, but it's way more than television. And we do know that kids and youth watch a minimum of 2 to 3 hours of television a day. That's actually decreasing. Kids are spending more time on their screens, so their marketing is getting into their screens. But we do also know that in terms of television exposure, about a quarter of all ads on children's television are for food and beverages. And kids are seeing 3 to 7 ads per channel per hour. So if a kid spends a half an hour before going to school watching television, they're probably seeing 2 to 4 ads for food and beverages before they even, have breakfast. And the foods that are being advertised are predominantly those that are high in energy, fat, sugar, or sodium. Only 2% of advertisements are for fruits and vegetables. So our kid watches television for a half an hour and then gets in the car with mom and dad to go to school, stop at a fast food restaurant. 1/3 of Canadian children and adolescents will visit a fast food restaurant on any given day. There's a lot of marketing techniques used in fast food restaurants, things like branding, packaging. We've all heard of toys that are given away at fast food restaurants. And those things can impact kids' tastes. Children prefer foods with colorful packaging or with toys, even when they're healthy. And this was some Canadian research done by Aaron Hoban, who's at Public Health Ontario now, on the Happy Meal effect. And so even if the foods are healthy, those toys can make a difference, but most of the times the toys are not paired with the healthy foods. So we think then, child gets dropped off at school, we think that the child perhaps is safe. But we actually have some recent research, well, some old research actually by the Canadian Teachers Foundation, showing that 1/3 of all Canadian public schools had some commercial marketing. Less in Quebec or French schools, and this has lots to do probably with Quebec's Consumer Protection Act that does ban all marketing to children under the age of 13. But some more recent research looking just in the Vancouver area, back in 2015, there were a median of 17 ads in every school, 0 to 57 and more ads in secondary schools and elementary, and a quarter of those schools had more than 38 promotions per school, and 55% of the foods and beverages marketed would not be allowed on their healthy school policy. So, picked up from school, on the way home, stop at the grocery store, and I'm not going to speak too much of this because I know Charlene Elliott will. This is from her work, and she will give us a much deeper view at this. But, you know, again, 350 to 400 foods in the supermarket are directed to kids, and lots of the power is related to the packaging, the theme of fun, games, activities, you know, shaped foods, spaceships, shaped chicken nuggets, things like that. And children perceive kids and adults' food differently. We also know that kids are spending a lot more time on screens, almost 8 hours a day in front of screens. And the top 10 kids' websites, this was a report that the Heart and Stroke Foundation published about a year or two ago, and it was from work by Monique Pop-Van Kent, who's been referenced already at University of Ottawa. The top 10 kids' websites had 25 million ads for food and beverages in 1 year, and 90% of those are unhealthy. Now, when you're watching television, you may see an ad for 30 seconds. When you're on the internet, that ad is there for a much longer period of time, and kids may choose to engage with that ad and go on to an advert game where they count the number of M&Ms or something to get their math points. You know, so these are issues that are extremely pervasive. So I know we're talking about exemption from sports in the new proposed legislation, but it is something that we definitely need to consider, because where kids gather, there is a fair amount of promotion of food-related products. We have, with Rachel, my student, we have been working on a project called Eat, Play, Live, which has done research in 51 recreation facilities in 4 provinces. And we've assessed food and beverage marketing through observation at every single facility. And in those facilities, there's a variety of promotions. Going up the stairs at the arena, on the boards, on the ice, on the boards, on the score clocks. There's a lot of exposure. On average, 10 promotions in each recreation facility that we surveyed, and those 48% of those promotions were unhealthy foods, 6% were directed directly at children, 13% had some sort of sports theme, which may indeed make the product more palatable to the kids, and 79% were considered large size. And that whole idea of pairing food and sport gives a health halo effect. The idea, and industry has used this, it's part of their playbook, the idea that promoting physical activity as the way to address the issue of poor health and childhood obesity, for example, that promoting physical activity is the way to address that you can eat whatever you want if you're physically active. That is just not true. So what might the collective impact of this exposure and power of marketing be? Just think about the, got some slow, 12 TV commercials a day, hundreds of foods at the supermarket, 17 ads in school, hours of internet ads, plus what else? Billboards seen on the way in the car. Kenton's not the only one who can put cute kids in his slides. These are my kids 20 years ago. They wouldn't fit anywhere near this box. But anyway, we can't just put our kids in a box. I think we really have to think about how we can protect our children. And this is where the possibilities come. And so I will leave it to Ashley when she gets up here to talk about the work of the Stop Marketing to Kids Coalition, which it has done amazing things to move things forward. And also Senator Nancy Green-Raine, or cousin Nancy Green-Raine. No, we may have the same last name, but we've never really explored our family trees. This is, we're moving forward in making a difference. It really is important that we pay attention to marketing and kids. Our food environments have indeed been poisoned, and I think Mary Libin said it best this morning. Do we really want industry to control our food environments? No, I don't. I'm sure most of you do not either. So I will just thank you and finish, and I think I did it in less than 12 minutes.
Thanks very much. Okay, so I was asked to talk about nutrient profiling, and I guess to all of you in the audience, maybe I can better define this as saying, well, how do we define a healthy food? Because that's really what nutrient profiling is. If the regulations are going to say you can only advertise the healthy foods and you can't market unhealthy foods, you need some mechanism to define, because regulators absolutely need a way to define what's a healthy food and what isn't. And that's what I've been asked to speak to you about today. And so we've actually managed to do it through a couple of things, and I'm going to walk you through how we've actually looked at it. And we've sort of tested out, and we've been working with Health Canada, testing out some of the modeling scenarios, trying to say, well, you know, how would that work? What would it work like? And we've done it through a large food database, and we call this FLIP, and I think FLIP sounds kind of neat. My students managed to think it up. I can't even take credit of it, but it stands for the Food Labeled Information Program, and it really is a database that we've been collecting since 2010, and it actually contains all the foods that are sold in grocery stores. We actually hired 10 dietitians, and they went up and down every single aisle in the 4 largest grocery chains and took pictures of every food that has a nutrition facts table, in other words, every packaged foods. And we collected them from the top 4 grocery retailers in Canada, and those 4 chains sell about 75% of the foods in Canada. And we actually checked with one of the big grocery chains, and we covered practically over 90% of the foods that they actually sell in all their brands. So we really do have a complete picture of the food database. And we collect anywhere from 10 to now almost 20,000 foods that we've collected each year, and we've done it 3 times. When we've got this food database, we've actually now got a couple of really good resources to actually start looking at questions like that. So we have the nutrition facts table from the information that's on the food, so we know the nutritional composition of each of the food by its brand name. We also have pictures of the food, so we can actually say, well, how many of these foods are actually marketed to children right on their packages, what kind of marketing is on. We can ask all kinds of other research questions, because we also know the price of the foods, but I won't talk about that today. But it really just says we can now follow the food supply and know what the composition of Canadian foods are. We also have another one, we call that Menu Flip. And it's the restaurant chains. And so what we did was we went and scoured all the websites of the food companies that sell in Canada. If they have at least 20 chains, and there's a directory of restaurants in Canada, we went through and scoured all their websites and pulled down and made copies of their nutrition information from every one of their menu items. And actually, of the top 50 chains in Canada, although we've collected over 90 chains, almost 100 chains, the top 50 brand names, mostly all of them but one, will actually have their data publicly available. It might not be easy to find, but it's there. And we've collected all that data, and it's now in a database, and we call that Menu Flip. And we've collected that data every couple of years, and it's about 10,000 foods that we collect each year. And so we now know the nutritional composition of the restaurant food supply. So that allows us to actually start looking at what's the quality of those foods, how many of those foods would be able to be marketed to children if these regulations go in place. So I said, what's nutrient profiling? It's a way of defining the degree of healthiness, or in other words, how healthy is a food. And that actually was defined by the World Health Organization by a committee that met in the around 2010. And it really is the science of actually classifying or ranking of foods according to its nutritional composition. And of course, it was developed by the World Health Organization because they wanted to be able to have a system to use in food policies and to recommend it. And what is a nutrient profiling system and how do you do it? Well, first off, you have to decide what I call inputs. In other words, make your decision on some nutritional composition. So it's usually about the amount of nutrients in the food. And you can look at it two ways. You can say the nutrients to limit, in other words, how much sodium is in the food, how many calories, how much saturated fats, and or you can say, well, how much of the foods we want to encourage. So how much fiber is in the food, how much protein, how much, or components of the food that isn't exactly a nutrient, but is there whole grain in the food, or fruits and vegetables. So that's the way, those are the inputs of a nutrient profiling system. And systems will change. Some will just be focused on the negative nutrients. Some will be focused on negative and nutrients. And then the next say is that you have to integrate it. In other words, there's a rule or an algorithm to make your decision. In other words, you've set thresholds or you set scores. You give so many points for all the positive nutrients, and you get so many points for the negative nutrients. And if a score is above or below a certain threshold, you make a decision that that's a healthy food or a less healthy food. And what we really want to stay away from, and governments could never do it in regulation. If you look at that little picture down the bottom, I mean, you and I would all say the broccoli is healthy and the double chocolate fudge brownie cake is probably unhealthy. But how do we make a decision whether we're going to allow orange juice versus oranges, or a veggie, low-fat, whole-grain pizza versus a meat lover's pizza? And so governments or regulatory agencies and even policy groups need some algorithms to make those types of decisions that's clear and transparent, because we really then want the food industry to hopefully adapt their food composition to hopefully get under those thresholds. So that's the information behind nutrient profiling. And this slide is a busy slide, but it just says what are the components of it. So I think there are many, many nutrient profiling systems out there, and I'll show it in my next slide. But you want to know what's it trying to do and who's it targeted for. And I always say if we're going to have a profiling system to restrict marketing of unhealthy foods to children, it's probably going to be a fairly strict one, and not a loosey-goosey one that you may have for, or a less stringent one for other applications. Do you have a number of food categories? Are you going to use the same system for all your foods, or are you going to change it and say, well, we'll let more healthy foods in one category and less in another category, and put our thresholds? Some change the thresholds by food categories, some don't. For example, in the Scandinavian countries, they allow salted fish into their food system because it's such an integral part of their food diets, even though in Canada, the salt level would probably throw it right out of the window, out the table, and we wouldn't really care because it's not really part of our diets in Canada. So you do have those adaptations around the world. And as they say, what nutrients are in. So whether it's nutrients to limit, which ones, and then how much. And then do you do it by serving or per 100 grams? Those are all various decisions that have to be made. And then you have to make decisions about those thresholds. Where are you going to set the cut point? If you do a score, you're going to say the UK set a score from 100. They set their cutoff at 62 to 64. Others might say, well, I want my cutoff at 80%. And others might say above or below. So it gives government regulators a time to set where their thresholds would be. As we heard Dr. Hutchinson say, they've decided the thresholds will likely be that 5%, those low in, so that decision has been made. They will use those thresholds to make their cutoffs. In other words, which foods are in and which foods are out. There's often many nutrient profiling systems have what I call inclusions or exclusions. Some of them say right off the bat, soft drinks will not be allowed in schools. That's an exclusion. No matter whether they're sugar-free drinks, they're out. Similarly, they might say flavored milks are out, unflavored or in, no matter what the fat level. Those are often policy decisions based on the food guides of countries. And then maybe how it's been validated. And this is just an example. A postdoc in my lab did a systematic review of all the nutrient profiling systems that are out there that either been developed by governments and used by governments in regulations. There's hundreds and hundreds more that have been maybe developed by one food company to give a check mark on their foods. They're not necessarily healthy foods, but these are the systems that have been developed by governments. And because we're talking about marketing to kids, I've circled that there are actually only about 7 systems out there that have been explicitly developed for marketing to kids. And most of them have happened in the last couple of years. And I put the Ofcom, and this was the first one out there, developed by the UK Food Standards Agency, and it was really to control the marketing of unhealthy foods on TV advertising. That came out in the early 2000s, and it's since spawned a whole generation of nutrient profiling systems very closely related to the original one from the UK. And so now we can see that we have about 7 systems, but they're all over the world. So there's some in the Americas, in Europe, Asia Pacific, and they're slightly modified, but now we've got profiling systems around the world. And my next couple of slides are going to say, well, what do we get when we use some of those systems? Because we started this work before we knew where Health Canada was going to go and what kind of profiling system they would choose to say, well, if you chose this system, you're going to have a whole pile of foods that you may not want advertised. Well, if you chose another system, you may get a more stringent system that we'd hoped they would use. So we used it to our database, and this was at our foods that we had collected in 2013, which was more than 15,000 foods. And so the orange-colored ones with the foods that would not be able to be marketed to kids, and the blues would be allowed. And we compared 5 different systems, and you can see it looks like about 40 to 50% of the foods would be allowed under certain systems, like the original Ofcom that was developed in the UK. And because it was the first, it was not a very stringent system. But the more recent ones developed by European system, that was the one that I helped be the neutral broker when they didn't want to pick one country over the other in Europe. I helped them chair that group. And they came to a much more stringent system, and less than 30% of foods could be marketed to kids. And more recently, the Pan American Health Organization came with an even more strict system, where only about 15% of foods could be marketed to kids using their system. So you can see that the evolution of, we're going to protect kids, we really want to have a fairly stringent model if we're going to make sure that only the most healthy foods are allowed to be marketed to kids. When we actually looked at those systems, and this gives you an example, if we looked at the Pan American system, it's not that every food had negative nutrients in every one of the areas, and we divided it up. So 84% of the foods could not be marketed, of the ones that are sold in Canada, could not be marketed to kids if we use that system. But it's because of different reasons. So half of them would be high in sodium, 40% were high in trans fats, still had trans fats. And that was any trans fat. That was their criteria, any trans fat. So we still have small amounts of trans fats, saturated fats, and you can read them, what the difference would be. So in the different, through the different nutrients. And now this is the same slide. When they're different, even though they're different, and they look the same, for example, the Ofcom one looked the same as one system in Canada, the blue and orange just say they may look like the same number of foods, but it will change by different food because every model was different. The outcome may be the same, but it may agree in certain food categories, but the orange ones is where other food categories are very different. So the different models may look like the final result, but they may be more or less stringent in different food categories, however they are. So there isn't total agreement even when they look like the final numbers are the same. And now my last piece of information I wanted to say is when we looked at those 4 or 5 systems, and we actually said which foods are already being marketed to kids, and I think I have goldfish up there, and I can't even remember what the other ones are, but 2 foods, but these are clearly marketed to kids, and we looked at which foods in Canada are already marketed to kids, and how healthy are they. The light, pale, green, and blue are how the Canadian food supply would look overall. The dark ones are the ones that are marketed to kids. And the take-home message are the ones that are marketed to kids, no matter what system we use, are less healthy. So much fewer, about half of them would even make through whatever system we use. So the ones that the food companies are marketing are the least healthy of any food category compared to the ones that are out there. So, and this just does the restaurant foods similarly. Virtually all the restaurant foods, very few of them would be able to be marketed to kids other than the sides. And I will say the chains haven't made their foods healthier. They've just offered healthier side dishes in the children's menus. So they're not any healthier either. And all the reds are the ones that wouldn't be marketed to kids. So just to conclude, I think the regulations are designed to restrict marketing of unhealthy foods to kids. So I think we do want a a really comprehensive system that's quite strict if we want to protect them. And I think no matter which nutrient profiling system the government did choose, most of the foods that are marketed to kids are the least healthy ones. So with that, I'd like to thank you very much.
Thank you very much for the opportunity to be here. I think from what we've heard today, there's a lot of things to be excited about. It really is an exciting time in federal nutrition policy. And I'm really pleased to be joining you here. Just gonna move us ahead. So there's no denying it. I think we've heard a lot about food environments, and they really do shape our food choices and ultimately our health. The marketing of unhealthy food and beverages is a part of that environment. And it's a huge issue, not only here in Canada, but on the global stage as well. But as we've heard, positive change is happening. So I'm really pleased to be here joining you from about 300 kilometers north of Calgary. This is my home base at the University of Alberta. And I'm really privileged to work as National Coordinator of the Stop Marketing to Kids Coalition, which is taking collective action on the issue of marketing to kids. Made up of leading health organizations from across the country and co-led by Heart and Stroke and the Childhood Obesity Foundation, we're working together towards collective change. The Stop Marketing to Kids Coalition advocates for restrictions on the marketing of unhealthy food and beverages to kids. As we've heard, children are bombarded by ads for unhealthy foods, and marketing works. It influences their food preferences, their food choices, and the foods that they pester their parents to buy, setting them up for unhealthy patterns of eating and increased risk for heart disease, stroke, and diabetes, health problems that are influenced by poor nutrition. But we're reaching a pivotal moment, and we have an opportunity to make a difference. Right now, the Child Health Protection Act, or Bill S-228, is undergoing the final stages of parliamentary review. It's a bill that would prohibit the marketing of unhealthy food and beverages to children under 13. Passage of this bill would mark a huge win for public health. Not only that, legislation, as we know, is not a magic bullet, but it is one effective tool that can go towards protecting children and supporting parents who are trying to instill healthy food choices. We do have another leg of the race ahead, and as we've heard, much research is happening to help support the development of this policy, and our federal government is taking leadership to make a difference in Canada on this issue. I think here Canada has a great opportunity to be an international leader on the global stage in addressing marketing to kids. So we have heard a lot about the research, we have heard a lot about what's happening at the policy level. So what role does advocacy have to play? And how can you be an advocate for children's health? I hope to answer these questions today by sharing a little bit of a story with you about how the coalition came to be and how we're connecting research to policy and practice and building a movement to take collective action on marketing to kids. So it all dates back to 2013 when Heart and Stroke met with the Childhood Obesity Foundation to discuss the issue and discuss current ways that they could encourage federal restrictions on marketing to kids. Leading up until that point, from around 2008 to 2014, across the country, a number of health organizations had published position statements and evidence reviews recognizing marketing to kids as a problem. It was clear there was a number of champions that wanted to take action on this, but what was missing was a catalyst for change, one unified, evidence-based voice. Heart and Stroke convened alongside the Childhood Obesity Foundation a group of non-governmental organizations, researchers, and health professionals from across the country to come together and derive a singular, evidence-informed consensus policy statement and set of guiding principles to encourage and inform marketing to kids policy in Canada, called the Ottawa Principles. And from here, we formed our coalition. The Stop Marketing to Kids Coalition, co-led by Heart and Stroke and the Childhood Obesity Foundation, is comprised of 12 leading health agencies across the country. including Dietitians of Canada, Diabetes Canada, the Canadian Dental Association, the Canadian Cancer Society, and others you see here on the screen. We publicly launched the coalition in 2016, and since then, we've grown exponentially. With endorsement from over 100 organizations across the country and notable health professionals, together we're collectively advocating for change. And together we form a united front with a common vision, a Canada where children and parents are supported to make healthy food choices in an environment free of food and beverage marketing to kids. So going forward, taking a look at what we have done over the past few years, we've conducted and mobilized research, we've supported key champions, and generated media to help raise awareness on the issue of marketing to kids and link research to action and policy recommendations. In 2016, we launched stopmarketingtokids.ca. This is an online hub to provide researchers, health professionals, and policymakers with the latest evidence, tools, and resources on marketing to kids. And I'd encourage you to take a look and visit our website. There's an opportunity to sign up for updates to learn more about marketing to kids. There you can also explore our tools, resources, as well as our National Stop Marketing to Kids webinar series featuring international best practices around marketing to kids. As you heard earlier, in 2017, Heart and Stroke released a watershed report on the health of Canadians. The Kids Are Not All Right. It examines how unlimited food and beverage marketing targeted at Canadian kids is negatively affecting their preferences, their food choices, their family relationships, and their health. Not only that, it also provides ideas and opportunities for governments, communities, businesses, and Canadians to take action on this issue. Heart and Stroke commissioned one of the country's leading researchers, Dr. Monique Potvin-Kent, who was mentioned earlier, from the University of Ottawa, to examine the volume of digital food and beverage marketing targeted at Canadian kids. And as you heard, an overwhelming number of ads are targeted at our children. In 1 year alone, collectively, children aged 2 to 11 see over 25 million food and beverage ads on television and their favorite websites. Over 90% of food and beverage product ads viewed by children and teens are unhealthy or high in fat, salt, or sugar. Those most frequently advertised on children's favorite websites are Kellogg's Pop-Tarts, Kellogg's Frosted Flakes, McDonald's Happy Meal, Red Bull Energy Drink, and Kraft Lunchables. And it's clear that Canadians recognize and understand that this is a problem. 70% feel that children are exposed to too much food and beverage advertising. The launch of this report, alongside the research, generated over 380 media stories, yielding more than 90 million impressions, shining a light on the extent of marketing to kids in Canada, the enormity of the problem, and the urgent need to protect our kids with restrictions. Champions have also played an incredibly important role, and a key strength of the bill has been its nonpartisan nature. Introduced by Conservative Senator Nancy Greene-Raine, who we're so fortunate to have with us here today, and also sponsored by a Liberal Member of Parliament in the House of Commons, MP Doug Eovalson. Important to the Coalition's approach and that of our members has been one of political neutrality. We strive to engage all political parties on the issue, and we focus on policy, not politics. Senator Greene-Raine has been a strong champion and unwavering advocate for children's health and taking action on marketing to kids. This photo represents a major milestone. Members of the Coalition are pictured next to Senator Raine shortly after she introduced her private member's bill, the Child Health Protection Act, in the Senate. And together we spoke about the significance of the bill. Leading up until that time, Senator Greene-Raine recognized how much of a problem marketing to kids was in Canada, and the Coalition at the same time was also broadening, and we were able to provide a catalyst for change, quick access to current evidence, as well as a vehicle to mobilize public support and traction on the issue. A key strength of the Coalition is we're very well connected. By pooling our connections and our networks, we were able to build relationships with champions in Canada and abroad. In fact, one of our members introduced us to the Jamie Oliver Foundation, and we were very honored that Jamie found a partner in us. In fact, the coalition organized and live-streamed a panel discussion where Jamie spoke alongside our members, Senator Raine, and a youth advocate, about a range of solutions to help Canadians make healthier choices, one of which included introducing restrictions on marketing to kids. Jamie Oliver spoke about the enormity of the food business globally and the urgent need for action around childhood nutrition and obesity. He acknowledged then Health Minister Jane Philpott's mandate on restricting marketing to kids and expressed his hope that Canada would seize the opportunity to be a global leader in nutrition policy and action. The coalition has also built a trusted relationship with media. In the last 2 years alone, we've generated more than 50 unique mentions of the coalition in news stories spanning television, digital, radio, and print. From the Globe and Mail to Global News, to Maclean's and the Huffington Post, we've raised awareness around the enormity of the problem and the urgent need for restrictions. Our hashtag, marketing2kids, with the number 2, has helped to carry the conversation across social media. These stories really showcase the power of collective advocacy on marketing to kids. We've conducted and mobilized research, built relationships with and supported key champions, and have generated awareness and called for change through a wealth of media on the issue. Through collective advocacy, we have built a movement, a growing network of parents, teachers, health professionals, researchers, and non-governmental organizations from every corner of the country. And together we're paving the way to improve children's health. I think what was raised today is the importance of our involvement as citizens to help to shape policy. So I'd invite you, if you're interested, to visit and explore Stop Marketing to Kids, where you can learn more about the issue and you can be involved in the process. By signing up for updates, you can find out more about the bill's progress, you can hear latest evidence on marketing to kids, and you can also learn about opportunities that are led by Health Canada to participate in public consultations, like we heard today took place last summer. So we're so close to a major win. Having a parliamentary bill to address marketing to kids would be a huge milestone. But as we also heard, there's still a difficult leg ahead. We need to ensure that there's robust regulations are created, and in order to do so, we need to work together. This is the most critical time for us to be involved in shaping policy, and Canada has a real opportunity here to make history on an international stage as a leader in children's health on the issue of marketing to kids, and together we can inspire action in jurisdictions around the world. So here, any of the resources I mentioned today, including the Heart and Stroke Report, can be accessed at stopmarketingtokids.ca. And I'd be happy to chat with you if you're interested after the session. I'll be out and about, but otherwise, thank you so much for the opportunity to speak.
So prepare your questions. I already got a handful given, and I think if you look at the board, or the screen, sorry, you can tweet them to hashtag foodpolicy2018. You can email them to foodpolicy2018@gmail.com, or you can pass your questions on cards to a volunteer, and they'll keep passing them up to me. For the first part of this panel, first question I wanted to ask you guys, opioids, food marketing, culture, online media, they're all now borderless. We're not as able to create restrictions within our nation to protect our people or to encourage our people to do X, Y, or Z. So as we enter an increasingly borderless world, how do we need to be thinking from a global perspective in order to protect our children and protect our families locally?
Yeah, I mean that's a very good point. It is quite difficult sometimes to protect our borders in the new sort of way of marketing. But there are things that apply, of course, and we would think that the legislation and the regulations that come out of that still apply to the producers of the marketing. When you think of what happens in broadcast, and I'll use television as the sort of example, is that what we see normally is that when you get your broadcasting through cables, there is a replacement of commercials as they come across. I mean, the big excitement was with the Super Bowl this last year because we didn't sort of go into replacement. So that is really the exception as opposed to the rule in terms of replacement. We also know that in the digital world, we know exactly where these things are coming from, and when companies have the ability to track us as to where we are in front of which restaurant we're standing to give us their little commercials, I firmly believe that we can actually think about twisting that on its head too, because the technology exists to be able to track where those messages are coming from as well. And I mean, you see that sometimes when you're trying to access sites that are coming out of the States, we get blocked. I mean, one can use that particular technology. I mean, just the week before last, one of my employees was over in Moscow with the World Health Organization Euro, where they are trying to do exactly that in terms of using technology, flipping it on its head to be able to apply it towards monitoring digital marketing. And certainly I think there's great promise in moving in that direction.
Can I just add that just because it's hard and it's global doesn't mean we shouldn't do anything, and that we should do everything that we can within our power, within our own jurisdictions. That's for one. But the second is we need to also look at other examples of global issues. And I think, for example, tobacco, which now has a framework convention on tobacco control that is global, and that does look at monitoring things like marketing of tobacco on a global scale. And, you know, we're not there yet, but that doesn't mean we won't get there.
Yeah, maybe I'll even add to that. 3 weeks ago, I was in Vienna with the World Health Organization Euro on a meeting that was specifically about marketing to kids. And so you had 25 countries in the Euro region, as well as myself somehow got into there, where we were sharing what we were doing and looking at best practices and trying to sort of help each other and learn from our experiences to about how you can sort of implement these things. And certainly the cross-border stuff comes up very strongly in the European context as much as it does here as well. So these are factors that a lot of countries, a lot of governments from different countries are looking at right now, and there are a lot of countries that have the very same sort of approach to it as what we're having as well. We just need to get the ball rolling and find the right sort of technologies and approaches to be able to do that.
Do you suspect that there's also a role for increasingly strong local communities and also increasingly strong diaspora that may cross borders? Like strengthening diaspora, so communities that reside across different borders in different nations who may also be able to strengthen local community while also strengthening international communities.
I'll just wade in there a little bit, and I think we're actually seeing it in a number of the initiatives, and I think in some initiatives Canada will be in the lead, and we will help the other countries along, and in the other cases we're seeing examples of where other countries have led, and I will use, for example, the marketing to kids. The first example that we learned from was the Ofcom. That was the UK. That was almost 10 years ago. They're updating their system now because, and so it's this continuous piggyback where, you know, they were the first one. They said now theirs is too strict, it's too flexible, too easy to pass their bar. They're making a more stringent system. And so I think these groups from one country after the other, we actually continue to improve, enhance, and learn from what each other are doing. And I think that's the benefit of having these global initiatives. They may start locally. It may even just be a city like we heard with New York City. It may be one country. But each activity emboldens and enables the other one to continue to improve and enhance and refine this system so that I think overall we end up with better and better systems as we each go along. But somebody has to be first, and I'll use the UK example as the first for marketing to kids. Maybe it wasn't that strong an approach, but it got us started. And I think Canada will have a more stronger system, a more enhanced system, and others will benefit from our learnings. And then maybe in a few more years we will have new regulations to strengthen the things that we, after that 5-year review. So I think policies are never static, and they take time, and they evolve over time, but we benefit from them globally.
I would also say that from an individual perspective, it's important that we can do things from the bottom up. So I'm thinking about my own data set and the notion of Still on? Oh, okay.
Stereo.
You know, we know that 90% of new product launches actually fail, and the food industry responds to that. So if parents aren't actually buying the products that are being targeted, then there is also pressure for reformulation. So I think there's also policy, which is huge, but there's also things that we can do at an individual level to move things along.
I just acknowledge that the Stop Marketing to Kids Coalition also recognizes the issue of cross-border marketing, and it is a component of the Ottawa Principles and something that we advocate for, which is the control of cross-border marketing. And we recognize, of course, as was shared by my colleagues on the panel, that this is quite a difficult and challenging task, but there are other things that we can learn from to inform our approach. And by seeing progress not only in Canada but in other countries around the world, we're really helping to set the bar to protect a larger body of children globally from marketing to kids.
Whether you've been involved in community activities, academic activities, policy consultations, are there voices that you feel are underrepresented, voices you haven't heard from, voices who you think we should be using this opportunity with the online people as well as the people in this room here today to help recruit in to generate those leads? So my question is, are there voices you feel are underrepresented or not represented, and what can we do about that today?
I would say absolutely one of the voices that has not been heard for a long time, and we're starting to integrate that, is those of teenagers, the people who are actually being targeted themselves. And I'm not talking very young children, because parents are making the purchasing decisions for that, but for the older kids where food is the #1 purchase for teenagers because of their disposable income, it is really important to get them engaged, because the research we have done shows that they're actually not that interested in being manipulated. And so if you bring them in and you talk to them about what appeals and why they're doing this and why they're making the choices that they do, you have a lot better insight in terms of what works for them, what doesn't, and then how to actually respond in a way that they don't feel is actually condescending and is positive.
I'll take it to the level of who we have right here. And of course, I just represent the federal government, but of course we have provincial and territorial governments who have very strong interests, and some of the provinces have made very good progress as well with respect to whether or not you can have advertising in schools, for instance, or Quebec, who really sort of was the trailblazer for all of this work, really for the whole world, trailblazer in all of this work. They're not here on this particular panel, but rest assured that we have meetings all the time with our provincial and territorial colleagues, and we're getting lots of input from them as well. And I don't want them to be forgotten in all of this for this gathering as well, that they have been very fundamental in this. And as we move forward into implementation of our regulations and the monitoring, we will be relying on our provincial and territorial colleagues to actually get into the places where they have responsibility in terms of the different food environments in the different settings as well. So they are a very integral part of this going forward, even though they're not represented on this particular panel.
I can speak further to youth as well, that they've also been a voice and advocates for themselves on this particular issue, and you'll see that across social media. Youth Against Marketing to Kids have also been speaking out about the problem and the urgent need for restrictions and making their voice known. And then to build on your point, Hasan, with what's happened in Quebec being a great learning example to build from, Coalition POIS is also one of the health agencies that sits on the coalition and has provided a wealth of knowledge and expertise that have really informed our work.
We're now going to move on to the audience Q&A, and so if Mr. Dalal can join us. So the first question relates to the food industry. And so there's an expectation of this question that the food industry is going to lobby hard. What can be done as from people in this room, what can be done to resist some of these lobbying efforts from industry?
I'll answer a couple of questions, and I don't know all of the answers. I mean, I think Health Canada's got a good way in terms of their transparency to make their lobbying very public, and we can call them. And I mean, I scrounge through those things, and I see, you know, how should I say, misrepresentations. Many of us will be the first to point them out and make sure they're there. But I think we also can give them some credit that some of them are doing, good things. And when we look at the food supply, I mean, they're very public data. We can actually show which companies are doing well and which ones aren't. And so when I showed the government reports, we actually have another set of reports we're doing called BIA Obesity, which is Business Impact Assessment. We're looking at the food industry, and we'll actually be able to say which food companies are actually doing a good job in terms of reformulating their foods, not marketing to kids, and which ones are doing a poor job. So it works both ways. I mean, I think we can sort of say where they're not doing good jobs, but I think we have many of the tools that can start calling out the ones that are doing good jobs or lack of. So that's part of it.
I think bringing to the forefront the current state of the research on the issue and the urgent need to address it is really important, but also seeing that there's a broad network of health organizations, health professionals, researchers that is well supported by a movement of Canadians that have a vested interest in this as an issue is really showing the need and the call for change can really be a strong advocate that could combat the lobbying and what comes up in opposition to change on marketing to kids. So that's a great strength, as well as looking at some of the tangibles, such as a poll of Canadians that shows 70% are on board with movement to address this particular issue, and that it's really in the interest of the country that we want to move in this direction.
So just feeding off of that stat, there was a question online which asked if we know whether Albertans, that same number is the same for Albertans as opposed to all Canadians, and that question was in general, but then a follow-up to that answer to Mr. Delisle on what can we do locally with respect to regulating food in schools, especially if there is such strong support.
What we have is, we do have things happening through federal and through provincial and within school jurisdictions as well, which have their own entity and policy. And I think what we're looking at is getting leverage from this policy going through where we can start to look provincially, how can we enhance this, how can we leverage this, how can we use it so that we can say legally, here's the framework we have, and how can we make this more consistent across the board. So I think really it's the seed for starting all the rest of the protection that we'll be looking at provincially, and we'll be working closely with education on that.
To the question around the percentage of Albertans who are in support of restrictions on marketing to children, I can't give you the exact number, but it is somewhere around the number that Ashley had quoted. This is something that our group and the Alberta Policy Coalition for Chronic Disease Prevention has done since 2009. So we have several rounds of surveys of both policymakers, which includes members of the legislature. It also includes policy influencers, people in school boards and such, as well as the surveys of the public. And we have found that since 2009, support for restrictions on marketing to children have increased. So Albertans are not redneck around this. This is something that we want to move forward on.
In fact, I'd add that a lot of adults are surprised there's as much marketing to children as is, and speaking to the awareness of it, I think a lot of people are surprised it's just become the norm. So.
And what can private citizens affiliated with these schools do to help move this forward and create that bottom-up strategy to meet what's coming top-down?
Don't write me letters. I think we sometimes make this separation of citizens as not being involved, and even today speaking with people who are very involved in their communities as citizens, but they can often be the biggest influencer of change, of finding out from the bottom up what can they grab onto and what can they build on. Asking questions of your municipal, provincial, and federal government of how does this apply to them and how does this apply to, so I actually do advocate for writing letters. How does this actually apply to your scenario specifically? How can you take this and make it stronger for what you're trying to do? And at the very worst of things, we're going to find out more directly what people are really wanting in their community.
And we can go even more grassroots than that. I mean, I think every single person can think of the ways in which marketing touches their lives, and people have control over their environments. So, for example, if you have children in a childcare setting and there's marketing there and you don't want it there, you speak to the childcare provider. If you have kids in school, there are parent councils. Parents have a very strong voice on parent councils. So I think it continuously goes up. I mean, I have to say that at University of Alberta, I can't remember how many times I have complained about the pouring rights contract that we have on campus. It hasn't made any changes in that policy, but they're aware of the issue. So, so sometimes it might not happen, the change might not happen right away, but we all see ways in which these things influence our lives. We all have pockets of influence. Use those pockets and push them.
And I'll just give one example with the Quebec legislation, which has had a number of restrictions on marketing totally for kids for a number of years. And talking with the folks at Coalition POI and other organizations in Quebec, they get a lot of their information. They don't have huge staffs to monitor the food supply, monitor marketing all over the place. But I'm telling you, those parents send them in those notes. Those community groups send in the notes when they see infringements. And that's their biggest army of inspectors, are the parents and the community people out there, just letting them know what's going on, and because they couldn't possibly do it themselves. And I'm sure as these things roll out, you wouldn't believe how powerful you as community and citizens are in ensuring that adherence to these policies and regulations really happen. And once people know that people are watching, that is a huge deterrent to keeping everybody in line.
Yeah, and I think the slide that I skipped that was kind of busy, in the center was all about community-based input. And that's really what one has to bring into this going forward. It's not just the government sort of imposing these things, but it's all of us, really, the citizen engagement that was talked about earlier, about all of us working together to change this food environment and this particular aspect of the food environment. But also keeping in mind that this is only one aspect of what we have to change about the food environment. It's not going to be the silver bullet to do everything. That's why we have to think about larger strategies. And as Mary presented this morning, what are the next policies that we have to then add to what we're doing and what we've implemented? This is not a fait accompli. We have changed the food environment. We've started down that path, and I think we're making great progress. But all of us sort of have to be involved in that continued job.
There's a question about low-income families already facing so much stress, now adding healthy eating requirements to that stress. How are we supporting them financially, and how are we making healthy food choices more easily available to those families?
Well, let's start with me, I guess.
We always start with you.
Yeah, I don't know. Or end with me, one or the other. Certainly when you think sort of the broader and our approach to developing healthy eating patterns, what we are doing in the modeling is we're working with Statistics Canada to get costing data on the foods, and we're taking a very clear intention that as we come forward with a healthy eating pattern, that the costs are involved. And that was certainly some work that we started, was it Val Tarasek, somewhere in the room right here. This started with the conversations we had about a year and a half ago with Val, and which has led then to this quite good collaboration with Statistics Canada to try and bring the costing into actually the modeling of healthy eating patterns going forward. So we're certainly, at that particular level, we're trying to stay attached to that. The second one, which I think, again, is quite broad, for a government of Canada, they've got a commitment towards developing a poverty reduction strategy. And this is not in Health Canada. I mean, the surprising part about food insecurity and stuff is that the levers for change are really outside of health. And so I think this is where it's important that you have a department like Employment and Social Development Canada, who have this commitment, again, as part of a mandate commitment from the Prime Minister to develop a poverty reduction strategy where this has to be taken into consideration. One thing we are doing in Health Canada as well is sort of monitoring the cost of food going forward. It's my office that develops the National Nutrition Food Basket, which is a costing tool that's used by all the provinces and territories across the country. And we're working with Statistics Canada right now in terms of developing a new tool as we release our dietary guidelines. We are in discussions with all the provinces and territories about the needs that they do have. So there's certainly an aspect of taking cost into consideration for our dietary guidelines writ large and sort of what works our way into recommendations.
I would just like to add that when we talk about healthy eating, we're not adding stress to low-income families. They already have that stress. Because I have never met a mom, low income, high income, middle income, who's not worried about the health of her children. And when I was a PhD student like 30 years ago, I hung out in housing projects with low-income moms and talked to them about the challenges of feeding their kids. And they all wanted to do what was best, and they were stressed out by the fact that they couldn't follow the recommendations. So, the reality is, and we're going to, I'm sure, hear a lot of this from Val this afternoon, but the reality is the issue is that it's a social justice issue that we have families in Canada that cannot afford to eat a healthy diet. And we need to improve income levels. We need to work to control the price of food. And part of that is related to industry's control of the food supply. It's totally unjust. The whole system needs to be changed. We're just talking about what we can do bit by bit, it's not adding more stress, it's already there.
I would like to go on a little further on the affordability of food and low-income families. And as we have across the country, Alberta is no different to Alberta with our remote northern communities. They may in fact have the money, but it might not be available or it might not be accessible. So getting affordable, healthful foods into an area isn't as simple as we think, and it takes more than just ministries, it takes more than just government, just even the transportation challenges we have, and then you can lump in a whole world that I don't even understand, where I'm finding out that ice roads are gone. Well, how the hell are they going to get in fresh produce, and why are they taking iceberg lettuce up there? But we have these immense challenges that go beyond dollars and cents. So in Alberta, we have increasing minimum wage. We have which industry says it's going to increase the cost of food. Well, we haven't seen that directly yet. We do have some incentives to help low-income families to offset some of the costs in hopes that it goes towards healthy food choices. But when we get into the low income, it's a much bigger thing than just the dollars and cents.
So we're running out of time. I think what I'm going to do is we've had about 20 questions. So I think what I'm going to ask a couple of the questions, and then I'm going to also, yeah. So what I think I'm going to do is I'll mention a couple of the questions, and we'll just go one by one, and you can choose to answer one of the questions or give a takeaway point that you really want to impart people with. So we'll give full license to you guys on how you want to do this. So one question is, please expand on the division of or the discussion about sponsorship exemptions for children's sporting events, and they reference what we can learn from excluding tobacco sponsorships. And actually, apparently, the Calgary Winter Olympics were the first tobacco-free games. So that's one question. The second option from online was there's negative advertising, but there's also Popeye. And did Popeye increase spinach consumption? And so is there ways to potentially enhance advertising of healthy foods or reward companies that advertise healthy foods? And so I'll let you answer either of those or give away your take-home point. And why don't we start from the far end and work our way back?
Okay. I would argue that Popeye is not a positive one if we look at some of the social impacts of racism and sexism in Popeye. If any of you have gone back and watched Popeye, it's pretty rough. So yes, there is positive marketing, but we do have very strong mention from our communities, the same as we have conveyed, is there any possible way to make it no marketing to children? And that, I think, is going to become a partnership between all jurisdictions. It's not just on the federal government to do that, so we have to start with that. And I don't think that we should necessarily have positive or negative, because it'll be hard to differentiate once they become older. If they think all is positive, well, then so is the negative at that point.
I guess that leaves me with the second question, which, of course, I was going to take the Popeye question and leave that to him. Certainly with respect to the exemption on the sports sponsorship, once again, the idea here is that we do not want to inadvertently stop access to amateur sports for kids, because physical activity is important. Now, certainly someone mentioned earlier, this is not supposed to be then the health halo. That was you. The idea is not to move into a health halo, and it's something we don't want it to turn into a loophole where all of a sudden it's open for all advertising and everyone goes into that. So as part of what we're developing as a monitoring and evaluation approach, we are going to be following that very closely, and we will certainly be going out and doing surveys to try and find out, what's the influence of that right now, what's the necessity of the funding that's coming in for sports organizations. We'll be following the approach that Australia has used in terms of monitoring what is the actual input of sports sponsorship. But that because we have a 5-year parliamentary review that is built into the bill when it goes through, then we'll be able to come back and we'll be able to look at the effects on that and then make any corrections that one has to make into the future, but based on real evidence as well.
If I look at a model for restrictions on marketing to children, I really do look at the Quebec Consumer Protection Act and their 30 years experience as being a very good model, which most people are not aware, but was not started with any health intent whatsoever. It was around decommercializing childhood. And so the whole idea of not marketing anything to children, toys, anything, and not even good stuff. So that is where I think we really want to start heading, and although raising the age. And so that includes sports sponsorship and all that sort of thing. However, policy doesn't happen all at once. So, you know, I'm happy to say, okay, we'll go with what we've got, and then we've got 5 years to review it, and then let's see if we can make it stronger. Okay, so, you know, for example, well, I already made my comments on the sports sponsorship, so I'll pass over.
But you did make me think of something, because with Quebec, because Quebec does allow sports sponsorship as long as it's very discreet. You know, so it's... Secrets, no. No, so basically what they say, you're allowed to have sports sponsorship if basically you're not including the mascots and sort of the big characters and stuff that basically say, you know, sponsored in small letters or sponsored by. So, I mean, that's sort of what got us going in that particular direction as well. But that's, you know, we'll see how that ends up. That's the intention, is that we're not trying to create a big loophole here, but we will be monitoring the effect of that particular exemption as well.
Juste un petit Bellegarde.
Okay, I'd like to respond to the Popeye marketing as well. The first part I would say is actually 5 years ago, SpongeBob SquarePants, no, 10 years ago, you could find SpongeBob SquarePants on bags of spinach too. So they were trying to use that as a leverage to getting...
Which is way funnier than Popeye.
Well, but the point is, I mean, there's no guarantee that the kids actually eat the spinach after they pester their parents to buy the spinach. So it creates a more commercial environment, but it doesn't necessarily create a healthier for you environment. And if you go back to the Quebec ban, it is about the ethics of marketing to kids, that there is something problematic about manipulating young children to pester their parents into buying stuff, and that's manipulative whether in fact it's spinach or whether it's Cheetos. So I feel very strongly about the ethical question of that. The other part I would say around the marketing of healthy foods is that in the last couple of years, those in favor of it in the public health community have advocated using big food marketing techniques to attract the attention of children. So, you know, you use the same techniques as big food to market things like carrots to kids. So Cheetos, baby carrots marketed like Cheetos. What's interesting about that is that in fact reinforces the desirability of junk food, because it says that carrots are desirable to the extent to which they imitate Cheetos or other junky foods. Eat them like junk food was actually the tagline for it. And the other part is those kinds of strategies, for example, putting a sticker like a cartoon sticker on an apple, transforms the apple into a delivery mechanism for the sticker. It actually doesn't teach anything about the food itself. It doesn't teach kids to eat healthy. It's just, you know what, they want the sticker. And I wrote about this, but you know, it reminds me of this 2005 Dateline segment where they showed kids who would pick a rock for their lunchbox with a sticker on it over a banana because they wanted the sticker, right? That was more important than actually the food. So it turns the apple or the banana into a type of plaything. And then, yeah, so I could go on, but that's my opinion on that. Yeah.
My turn now, and I actually was thinking that my previous panelists have done a great job speaking to those questions. You gave us the opportunity to say something different that wasn't. And I think I'm going to say one other thing that might be a bit of a take-home message, but I think we're in a policy era right now, and it goes to my earlier talk this morning, where we've got a number of policies in play. And I think we have to remember that any one policy by itself isn't the magic bullet. And the real strength is having a suite of policies. And so we've got a current suite of policies. And I think what I mentioned, allude to, a healthy eating strategy too. This is only one step in terms of really the overall objective shouldn't be to focus on one little bit of the other. We want a food environment that really supports healthy eating. And we will do that one policy at a time and more so that we have a whole suite of policies that deal with different aspects of the food environment where it really is making it challenging for consumers to eat healthy. And if we have a really good food environment policy suite of tools, then we can have the biggest impact on Canadians' health. That was my 2 cents worth.
Mary, that was powerful. I don't know how to follow that. I will speak to the sports sponsorship question because the coalition does have a position on that. And I want to echo what's already been said, which is that really we're starting from a place where we don't have any federal restrictions right now on marketing to kids. And we are starting from the ground up. And sometimes that does take a stepwise process. And I think we're coming forward with what the government has proposed is something that is a really strong level of protection for kids. And the coalition right now is focusing on the advertising that kids are seeing on TV and on digital. And while we recognize that marketing takes place in the sports environment, we have chosen to support the direction that we're going at this point in time, but also recognizing that the sports sector can also actively seek opportunities from industries other than the sports and beverage industry. If given the opportunity, maybe other industries will step up to the plate. We did see that happen in tobacco, and I'm hopeful that we'll also see that happen here. But as Hasan mentioned, this is an area that's going to be carefully monitored so we can see exactly what is happening going forward, so that's very promising.